You may have noticed that when you go to your doctor, you are no longer important. The staff, the doctor, and nurses run people through like cattle. It didn't used to be like that. When I was a child, doctors came to your house, and you paid them cash, an amount you could afford, even if you went to the hospital. But today, you can no longer afford medical care unless you have insurance. How did the rates get so high? Insurance. If medical costs are not high, nobody buys insurance. So the insurance industry does a number of things to drive medical costs up. They require that you go to a general family doctor before visiting a specialist, so there's double the cost of office visits right there. They pretend not to know what's wrong with you, and they do all kinds of tests. Even though you know what is wrong with you, and your doctor knows what is wrong with you, your insurance company does not. They just pay for whatever tests and exams the doctor says you need, and the doctors make money on all those extra tests and office visits. Insurance companies encourage doctors and hospitals to jack up rates because those high rates force people into insurance, and the insurance company simply charges higher premiums as medical costs go up. Nobody seems to catch on to the scam. Higher medical costs help insurance companies, doctors, clinics, and hospitals, so they're always finding ways to raise medical costs on us, and we are not doing much to stop this. We have a system where each of us is paying thousands of dollars a year in insurance premiums and sometimes consuming no medical services. Billions of dollars are going to insurance company profits. That is why the insurance companies build the biggest skyscrapers in the middle of every major city. They are investing the money you paid for no healthcare. The key to all this overcharging and disintegration of our medical service industries is the disconnect between the physician and the patient. If you were paying directly for your medical services, you would have conversations about those costs with your physician. You would let the doctor know how much you can afford, and you would ask the costs of every service before accepting it. We don't do any of that. Medical providers look at you like you're crazy if you ask the cost of their services. What do you care? You have insurance, they say. I have no idea what they charge for my services, they say. You'll have to talk with the back office, they say. So, from the doctor's point of view, you are just the patient, you are not the payer. You're not really the customer or the client. You are a way to rack up fees for services, exams, prescriptions, and treatments to jack up the revenues for your doctor, clinic, or hospital. You are not a patient, you are a cash cow. Remember that your doctor gets kickbacks, fees, and bonuses from drug companies, device manufacturers, and the other doctors they refer patients to. They don't tell you what makes them money because, in their eyes, it's none of your business. One reason that fees go through the roof is that the payer, the insurance company, is not the doctor and never sees the patient. They have no idea what you need, what is wrong with you, or what will cure you. The insurance company has no way to know what would be the best medical service for you. They have no choice but to leave that up to the healthcare provider, who can use that situation to turn a patient into an ATM machine. If the doctor or hospital makes money by providing more services, the accountants in the back room tell them in every meeting, more services per patient means more profit. Pretending not to understand your medical problem is now one of the most profitable techniques of any medical practice. They tell you that you need more tests, more office visits, more exams, more specialists, more trips across town, and more hours sitting in waiting rooms, because that's what racks up the bill. Why should you care? You have insurance. You should care because, by now, your insurance premiums are nearly as much as your rent or your house payment. For your house payment, you get a house. For your insurance premium, you may get nothing at all. What about that catastrophic illness? That's what they hope you'll say. When we buy insurance, we're acting on fear, not mathematics. Medical insurance is like a gambling casino. You bet you'll get sick, and the insurance company casino bets you won't. The insurance company casino takes in huge profits, builds huge skyscrapers, and makes its shareholders rich. The casino always wins because the casino uses mathematics, not fear. The gambler runs on emotions, the casino runs on math. It's as simple as that. Emotions and fear are your most expensive hobbies. Our medical system is totally broken. When you are a medical patient, You are exploited and manipulated to maximize medical industry profits, and you pay the cost through your insurance premiums and your taxes. By the time people have that catastrophic illness, they have usually paid 2 or 3 times the medical costs over a lifetime of insurance premiums and taxes. You believe you can't afford to pay cash for healthcare, but the insurance companies don't pay anywhere near the amount the hospital bills them. If healthcare is expensive, it's because we're willing to pay anything when we're sick and injured. Again, we operate on emotion, not reason. If you're dying, and they could save your life for $20, do you not think they would charge you $200 when you're glad to pay that? Maybe $2,000 or $20,000? Why not? You'll pay it, you're dying, and they can save you. So once again, the real cost gets disconnected from the actual service because of our emotions, our fear, our human nature to not worry about money when health and lives are at stake. The healthcare system we have is based on human nature. It's human nature to be afraid of illness, injury, and high medical costs. It's human nature to not want to talk price with your doctor and healthcare provider staff. It's human nature to want insurance. It's human nature to use emotion and not reason or mathematics to solve your medical problems. It is almost considered inhuman to think about costs when your children or family member are in need of medical care. Unfortunately, the medical industry, the insurance industry, and the government all understand human nature. They know your weak spots, they know how they can get to you and separate you from your money by simply exploiting your human nature and your love of your family. It is a morally disgusting exploitation of the sick and injured, but they do it and seem to feel no shame in doing so. It is not hard to work around that system and find a better way, but you have to overcome some of that human nature. You look for cash-only medical providers, you save and plan for medical emergencies, and whenever possible, you ask the cost of each medical service before you allow them to provide the service. You look for doctors who go for the cure and don't just push drugs, extra tests, and extra office visits. Then you pay cash and walk out the door. Look for ways to have little or no medical insurance, and fight against any mandatory insurance schemes. By the way, mandatory insurance is unconstitutional, that means it's illegal. We can beat it if we want to, but we will have to make this a major movement, not just a few rebels. Maybe we can call this movement Cash-Only Cure-Oriented Healthcare, COCO for short. Remember, the insurance industry, government, and drug companies are all in collusion with your healthcare provider, and that is where a lot of the trouble, waste, and cost is coming from. The less government, insurance companies, and drug makers are involved in your healthcare, the better off you will be in the long run. We can beat this broken, corrupt, thieving healthcare system if we start to do those things and realize this is a problem we have to fix. We may have to go against our human nature and our emotions if we ever want to have effective and affordable healthcare.